It is brilliant to be here. What a fantastic day and a half we've had. And congratulations to Mark Fox and the NetEvents team. I would describe this as an intellectual super collider. The theme of the event is around digital transformation. And we're going to do a deep dive on probably the most intractable industry for digitally transforming, which is healthcare. So the title of my talk is How Do You Transform Healthcare Using Digital in 20 Minutes? Now, we're not going to transform the entire industry in 20 minutes, but I'm going to tell you how to do it in 20 minutes. Healthcare is incredibly complex. We want to make it really, really simple. And what we're recommending is that all of the players across government, across ecosystem, take this idea of stay left, shift left, 10x as a lens for fixing healthcare and explain what that is. And it is aligned very much with the UN Sustainable Development Goal number 3, good health and well-being. So what is our perspective? A ticking time bomb, healthcare under threat across Western Europe, healthcare in crisis, 500 people a week dying in the UK because of delays in emergency care. New York Times last week, doctors aren't burnt out from overwork. We're demoralized by our health system. We have so many fantastic, dedicated people working as clinicians in our healthcare systems, but they're being failed by the system. It's not just the NHS, Europe's healthcare crisis, the coming collapse of the US healthcare system in time a couple of days ago. So we have a real crisis. And then we have a demographic time bomb. In 2018, we passed a threshold where there's more people over 65 than are under 5. Some of the top, the countries that are the poorest, have the highest demand for health services, are also the fastest growing. Some hospitals are averaging 100% staff turnover every 5 years. Can you imagine if our businesses were having 100% turnover every 5 years? It's really not sustainable over a 40-year period. But what McKinsey saw was an 818% increase in US healthcare costs. GDP only grew a quarter of that, and wages grew a lot less. So this is an unsustainable problem. Currently, this year we're hitting, in the US, about 20% of GDP spending is on healthcare. Healthcare is incredibly unproductive. We're a laggard in digitalization. It's the highest source of employment, and yet it has experienced negative productivity. It's a digital laggard.
Martin is calling for a revolution, a whole new paradigm in healthcare and society. And he's not alone. Last September, 50 digital health leaders from around the world met in New York as part of the United Nations General Assembly. And out of that came what is called the Manhattan Manifesto. Martin will be detailing what that means later. But first, some examples of what Martin calls digital health.
So today, 70% of deaths come from preventable chronic diseases. And Mary Lou Jepson talked about, a lot of us are going to die from heart failure or from stroke or from diabetes or from cancer. 90% of healthcare costs are from chronic diseases. Now, you can't cure chronic diseases, but if you get them early enough, you can reverse them. So what I'm advocating and what we're advocating through Stay Left, Shift Left, 10x is a completely new paradigm around healthcare, one that is very digitally enabled. What I'm suggesting, and colleagues are suggesting, is that we leap ahead to a whole new digital health model where everything is actually based around the patient and it's based around your phone. So on my phone, I have a personal electronic health record. It's got my recent MRI, it's got my colonoscopy, it's taking live data from my Fitbit. And I should be able to walk to a hospital or to my GP and give them immediate access. And I think we need to totally reimagine the way that we do healthcare, and it's entirely possible. So we're witnessing the birth of a new discipline. It's an Uber discipline. It's digital health. It's about digital. It's about health. It's about genomics, about economics. It's about demographics. And this new discipline has the opportunity to transform health as we know it. I think we need 3 Copernican shifts to think about the way our new healthcare system should be built. It should be about wellness rather than illness. It should be centered on the patient. Patient knows best. And lastly, the shift should be from the hospital to the home. and I'll show you how that could be possible. Behavioral stuff like exercise, like nutrition, contributes 40% of our outcomes. Genomics, genetics is 30%, environment is 15%, etc. Healthcare is just 10%. But that's exactly where we're spending all the funding. This is a picture of funding across the EU. The EU is just spending on average 3% of health spending on wellness, prevention, proactive, 97% on illness. But these are the area of lowest returns. Can you imagine in finance if you were putting all of your money into the portfolios that have the lowest return? It just doesn't make sense. And then we have the opportunity. In Ireland, our hospitals are full. In the UK, they're full. We can use the home. Patients want to stay at home. You can have better vital signs in your home than you can have in a hospital. So this is the future.
Increasing hospital capacity by 10 times using the hospital at home model. This is the first of many 10 times claimed by Martin and backed by data revealing astonishing return on investment results.
What are some outcomes? Let's look at what can we do faster, what can we do lower, what can be higher volume. So on average, it takes 10 years to diagnose a rare disease. In Ireland, we have 300,000 people with rare diseases. With whole genome sequencing, we could diagnose that 10 times, maybe 100 times faster. We can identify in a pharmacy the start of a chronic disease rather than somebody showing up in AD with stage 2 cancer or hypertensive crisis. We have been cleaning some of our hospitals with ultraviolet robots that do it 10 times faster than the cleaners, that do it 3 times better and 2.5 times cheaper, but is done in collaboration with the cleaners. We can operate virtual wards 10 times cheaper, so it's at least 10 times cheaper to have a person monitored from home than in an acute hospital. We could have 10 times lower admission rates for heart failure. What we've seen is we're on track to reduce the number of deaths in Ireland from skin cancer from 1,500 a year to 150. In terms of higher volume, we could increase the capacity of the Irish healthcare system by tenfold by monitoring people in their homes. We can have 10x higher screening rates using digital assisted technology in our pharmacies. And we can have a 10x increase in monitoring rates of our patients. Our heart failure patients in Ireland are monitored 8 times a year. Using a remote monitoring technology, they're monitored continuously.
Time for our speaker to get back to the Manhattan Manifesto mentioned at the beginning of the presentation. What is it, and what is its aim?
So what is the Manhattan Manifesto? And this came out of our meeting in New York last September. It's about championing a new era of digital health through collaboration, cooperation, and change. I don't have time to go through this, but I just want to highlight a couple of key points. So we think policy needs to happen at an all of government level and a whole across ecosystem. We think everybody should have universal access to integrated global shared health records. We think that should be on the phone, on the cloud, very secure. We want to move to an outcome-based healthcare model because people like Michael Porter and others have said too many people get paid more to do the wrong thing. So healthcare's business model is broken. We need to shift it to outcomes. And then lastly, we need to allocate the appropriate financial and regulatory resources towards achieving digital transformation. So here is the schema of the Manhattan Manifesto, and this was inspired by the work that was done in Canterbury in New Zealand, and Carolyn Gullery, the architect of the Canterbury model, is a key player with us. But it starts with people at the center, and we need to move from activity and institutions to fragmented to passive recipients of healthcare to where we have active participation, it's integrated, we have virtual services, it's about prevention. So this shift from illness to wellness, and there are 12 guidelines in the manifesto, and you'll see that when you get a copy of it.
This summary is just one of many documents provided by Martin Curley for those attending the 2023 NetEvents Global Media Summit in San Jose. for a whole lot more discussion, including the Q&A session with global media, as well as the complete presentation slides. The complete transcript plus accompanying PowerPoint materials is available now from netevents.org.